I'm Greg Cline, Senior Key Account Veterinarian with Boehringer Ingelheim. Andrew, when we talk about significant diseases, Lawsonia intracellularis and Salmonella enteritis is two of the diseases that we're going to deal with in the pig industry at some point or another. For decades we've known that Lawsonia intracellularis in ag surveys have been shown to be either present or have been present on farms in more than 90% of the farms. It's a very common disease. Salmonella, maybe not quite as common, but certainly we see it. And both of these lead to the clinical diarrhea. But probably there's an insidious, less observed form of the disease, and where we may not see observable diarrhea, but we're seeing decreased nutrient uptake. We're seeing decreased performance. And in times like this right now, when we can improve efficiency, is probably much needed. The enterosol ileitis vaccine we've had on the market for over 20 years. It's been the gold standard for a long time on managing ileitis. The Salmonella TC is the only vaccine on the marketplace where we have both Salmonella cholerae and typhimurium. It's the only vaccine, the Salmonella vaccine is the only vaccine on the market that's been shown to provide cross protection to the most common Salmonella strain that's in, well, people and pigs today. So long story short, vaccines are the way to go. Now both of those vaccines are administered orally, and that's a good thing. As far as safety for the pig, as far as ease and comfort for the user, those have been the ways that those vaccines are administered. Traditionally, there's been two options when we orally administer a vaccine, and that's picking up every pig and squirting it in their mouth. And Andrew, that's kind of an ornery process. Picking up every pig and squirting it in their mouth. No one likes to do that. It's not something I like to recommend. So traditionally on these vaccines, they've been administered through the medicator, through the proportioner at some point after weaning, after the pigs have left the farrowing crate. Today I'm kind of excited to talk to you about another option that we've came up with to orally administer this vaccine, and that's through the use of a gel that we combine with the vaccines and administer it to the comfort mat in the farrowing crates. Gives us some key advantages. Of course, we're in a time where labor's kind of tight on farms, and so if we can do a process of vaccinating that's easy and effective, then we think that we're going to have more likely to have precision in the administration of the vaccine. So the gel is going to be mixed. The vaccine, the appropriate number of doses for the pigs in that farrowing room is going to be administered, and then we've been administering 120 ml of that mixed product onto the comfort mat in the farrowing crate. Now, I will tell you, you kind of question, when you first come across a new application, can this really work? A couple things I will tell you. We've done challenge studies, where pigs were vaccinated in this manner, and then they were challenged with Lawsonia and Salmonella, and the vaccine is effective. Got empirical data where the pigs have been vaccinated in this manner for over a year and no problems. So we got research studies and we got observational data that would suggest that this is an effective way to go. But probably the most convincing reason to consider this is vaccinated a small farrowing room a few months ago, and there were 48 crates in that room. We vaccinated that entire room in 3.5 minutes. Now that is phenomenal, when you think about that. Actually, that day, the farm personnel that was administering the vaccine turned to us and said, I want this, because it was so easy and so fast, and it made their day go better. They're not having to pick up pigs and administer. It's just a positive way of doing it, and it looks very effective. I strongly encourage that for the producers to start with their herd veterinarian and see through the consultation with your herd veterinarian if these vaccines are correct for you. Consultation with your herd veterinarian, is this oral administration methodology appropriate for you? Your herd veterinarian is the best versed in supplying that information. BoehringerIngelheim.com, there should be some information there as well.